Today's medical-centric topic is tongue piercing infection, signs, symptoms, and treatments. Getting a tongue piercing can be a fun and exciting way to express yourself, but like any piercing, it can come with risks. One of the most common risks associated with a tongue piercing is infection. In this video, we'll take a closer look at how to identify and treat a tongue piercing infection, including signs to look out for and steps you can take to prevent infection. Identifying an infection. The first step in treating a tongue piercing infection is identifying the signs. Here are some of the most common symptoms of a tongue piercing infection. 1. Swelling. If your tongue is significantly swollen around the piercing site, it may be a sign of infection. 2. Redness. A reddish discoloration around the piercing site may indicate infection. 3. Pain. Pain or discomfort around the piercing site may be a sign of infection. 4. Discharge. If you notice any discharge or pus coming from the piercing site, it's likely infected. 5. Fever. If you develop a fever after getting a tongue piercing, it may be a sign of infection. Treating an infection. If you suspect that you have a tongue piercing infection, it's important to take action right away. Here are some steps you can take to treat the infection. 1. Rinse with salt water. Mix a quarter teaspoon of sea salt with 8 ounces of warm water and swish it around in your mouth for 30 seconds several times a day. 2. Use an antiseptic mouthwash. An over-the-counter antiseptic mouthwash can help kill bacteria in your mouth and prevent further infection. 3. Apply a cold compress. Applying a cold compress to your tongue can help reduce swelling and pain. 4. Take pain relievers. Over-the-counter pain relievers like ibuprofen and acetaminophen can help manage pain and reduce fever. 5. See a doctor. If your symptoms persist or get worse, see a doctor or a piercer to get proper treatment. Preventing infection. Prevention is key to avoiding a tongue piercing infection. Here are some steps you can take to reduce your risk. 1. Choose a reputable piercer. Make sure your piercer is licensed and follows proper hygiene practices. 2. Follow aftercare instructions. Your piercer should give you aftercare instructions to follow. Make sure to follow them carefully to reduce your risk of infection. 3. Avoid smoking. Smoking can increase your risk of infection, so it's best to avoid it altogether. 4. Be mindful of what you eat and drink. Avoid alcohol, spicy foods, and hot liquids for the first few days after getting your piercing. A tongue piercing infection can be uncomfortable. If you suspect that you have an infection, take action right away and follow the steps outlined in this article to treat it. And remember, prevention is key to avoiding an infection in the first place.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.